I'm McKenzie Miller, and this is my blood insertion video, which I'm filming by myself. Here's the room that I'm in. Hi there, my name is McKenzie. I'm a student nurse. I'm going to be doing your blood transfusion today. Can you just tell me your name and date of birth? Betty Jones, 5/21/1952. Alright, and that matches with my chart here. Betty Jones, 5/21/1952. So check my orders, and it says that I'm giving her blood today for low hemoglobin. Betty, the doctor was in here earlier, and he talked to you about why you're getting it. And I know you guys signed this consent form together. And I'm sure he talked about this, but I just wanted to go over some of the reactions that some people might experience. So you let me know if you feel a headache, chills, back pain, chest pain, anything like that. Anything that could indicate there's a reaction going on. Just let me know and we'll stop, okay? So the first thing I'm going to do is get some baseline vitals here. I'm going to listen to your lungs. Alright, and your vitals are within normal range, and your lung sounds are clear. So let me check out this IV site here. Okay, 20 gauge. So that'll be big enough for our infusion here today. And your site looks pretty good. There's no redness, bleeding, no swelling. Looks good. I just want to check and see how well it flushes here. Okay, first I'm going to clean this little hub here. And throw that in the garbage. Make sure my flush isn't expired. I'm going to get all the air out. Okay, very good. Lock that. Press off. And I'm checking my orders for a special filter or blood warmer, and I'm not seeing one. I'm just going to get the tubing ready here while we wait for the blood to come up. I'm going to be using normal saline to prime the line, which is the only fluid I can use when I'm doing a blood transfusion. Make sure all the clamps are closed. Okay. Sort myself out here now. Open my clamp. Prime the line over the garbage here. make sure my normal saline is above the filter here. Okay, got all the air out. Clamp that one. I'm going to set this here. Now that my blood's here, I'm going to verify this with another nurse. She's going to read off of here, and I'm going to read off of the bag. So we have a red armband number of 456654. Medical record number of 224466, which she repeats back to me. Location HLRL, she repeats. Account number 123456, which she repeats. We have Betty Jones here. Betty Jones, which she repeats. Red armband 456654, she repeats. Patient blood type B positive, she repeats. Donor pool number 7890, she repeats. Units in pool 4, she repeats. Volume 250 milliliters, she repeats. Blood component packed red blood cells, which she repeats. Expiration date and time 6/21/2022 at 1500, she repeats. Donor blood type is O positive, which she repeats, and that's compatible with my patient blood type of B positive. The compatibility test is completed, she repeats. Today's date is 1/27/2022, she repeats. Ascension number 1, she repeats, and the tech is LHRN, which she repeats. I'm going to mix my bag here by inverting it a few times. I'm looking for any discoloration or clumps, clots, any floaties, and it all looks good. Okay, now I'm checking my order with the requisition here from the doctor, and everything matches. Okay, up there. And now I want to prime the line with the blood, so it's almost all the way at the end, so my patient isn't getting a bunch of saline. And I'm gonna attach this here over here. Remove my caps. Two. And these clamps. And get my pump going. We have a new patient here. And put in her medical record number here. 2, 4, 5, 6, 6. We're going to select red blood cells. And for my rate for the first 15 minutes, I want to do 50 milliliters per hour. And I'm going to set the volume to be infused at 240 so that way my line doesn't run dry. I'll hit start. And I'm going to be staying with you for the first 15 minutes to look for any signs of a transfusion reaction, which that would be like a headache, chills, back pain, chest pain, nausea, vomiting, anything like that. If you feel any kind of funkiness going on, just let me know and we'll stop the transfusion immediately. How's that feeling so far? Pretty good? Okay. I'm going to reassess my vitals in 15 minutes, and then as my policy or my agency's policy requires. And once the transfusion is done, I'll flush the line with normal saline. And then I would dispose of all of my supplies in the biohazard. I'm going to chart that I gave Betty Jones 4 units packed red blood cells on January 27th, starting at 1900. I'll document the time that's finished. After the first 15 minutes, I can increase the duration or the speed to go a little bit faster. I have up to 4 hours to do the whole infusion, and the tubing is good for 4 hours. I'm gonna document that she had no reaction. I'm gonna document that her IV site was clear, there was no bleeding, no swelling,